Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OB-GYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome back, Sky community, to another episode of Sky Women. I am delighted that you have chose to join us today. We have Kim Vopni with me today. She is a pelvic health specialist. Kim is really cool. We have just been chatting before starting recording, and she is a fitness trainer, correct, Kim?
Correct.
And she's combined everything that she's learned through her own pregnancies and births and coupled it with all that she's learned in the last decade of helping women and treating, and has created online pelvic floor exercise programs, as well as online coaching for women in pregnancy, motherhood, and menopause, because we all are going to go through these stages. And it's so cool what you're doing, Kim. It's time for pelvic health to be discussed and offered to all vagina owners. I completely agree. I am been perusing her website for the last couple of days, and I'm just loving it. So welcome, Kim Vopni.
Thank you. Pleasure to be here. I appreciate you having me.
Absolutely. So walk us through just your journey in terms of becoming an evangelist for pelvic health.
Yeah. Yeah, it's certainly not something that I grew up thinking that I would become, but I did grow up with this fear fascination of childbirth. And I remember seeing a childbirth video as part of our sex education and thinking that wasn't something I was interested in doing. But still I went and looked at my mom and all the women in my life and thought, well, they did it and they're still carrying on. And so anyway, long story short, when it came time to I decided I did want to start a family. I was really determined to have a different story than my mom. So she had had a episiotomy birth. She had incontinence. She had chronic back pain. She ended up having a hysterectomy for, heavy bleeding and all these kind of pelvic health issues. And I didn't want anything to do with that. So I was determined to have a different story. My midwives had introduced me to a biofeedback device called the EpiNo, which is a product out of Germany. And the name stands for no episiotomy. And really at the time, with what I knew back then, so this is 17 years plus years ago, my main goal was to prevent tearing in childbirth and to prevent incontinence. So those were the two things that I knew of because my mom had dealt with them. And that was what I was looking to avoid. And I used this EpiNo. I had a really good experience. I did not have any external tearing at the perineum. I didn't have any postpartum incontinence. So I thought, okay, this is a great product. And contact the company and asked to become a distributor. And that's sort of how it started. So I started with a little e-commerce store, and then I started to have pelvic health physical therapists refer their patients to me. And I had never heard of a pelvic floor physical therapist. And when I reached out to a few that were referring to me and just said, thank you, but also what the heck do you do? And once I learned what they did, then I thought again, so why is it that this product that I used, why don't more people know about it? And also, now that I've learned about pelvic health physical therapy, how is it that not every single person who is giving birth is working with a pelvic floor physical therapist? I just think that they're such a valuable resource that nobody knows about.
Yes. And I feel like in the last 5 to 10 years, even it's really taken off in the States. We have so much more offering available. This is standard of care in Europe.
Yes.
We're trying to catch up.
Yes, exactly. And I agree with you. I mean, since I've started, especially in the last sort of 5-ish years, there's been this huge explosion of pelvic health. And thankfully, but we still do have a long ways to go. And sometimes I think, I feel like I've been repeating myself for so many years, but there really still are so many people that just haven't heard of it. So we still have a long way to go.
Yeah, absolutely. So you've talked to us about your why. You talked to us about the biofeedback device that kind of changed things for you. Also, the culture has kind of changed in OB-GYN. We don't do episiotomies like we used to.
Right.
Thank God for that, right?
Yes, exactly.
Vaginas surprise me all the time.
Yeah. Back in the day, like when my mom had, that's just what you did. That was routine. And yes, thankfully that's not routine anymore, which is great. And there is an evolution that's happening. I feel like there's more collaboration that I would like to see between different types of care providers and professions as it pertains to supporting women through pregnancy and through menopause and pelvic health journeys.
Agree. I think that our care has very much been piecemealed. And so that's why at Sky Women's Health, we take a comprehensive approach for sure. And we work with pelvic floor physical therapy. We have them in the office. So yeah, all the stages, we need additional support. So walk us through, you were really bridging this gap between pelvic floor PT and fitness, right? Because a lot of times the limiting factor, we just accept that, oh, we've had a baby, so now this is going to be normal. I'm going to leak urine, or I'm going to have this heaviness in my pelvic floor, not really understanding that there might be something you could do for it. And it's a limiting factor in our fitness because we want to be active. We want to be running. We want to, be back on our yoga mat or whatever that activity is that brings you joy. And you feel limited by the physical changes.
Right.
Yeah.
Yeah. Yeah. And right now, and this is also, I have seen an evolution to some degree of this, but there is a 6-week green light that has been, we all have heard that term. We all kind of have this understanding that at 6 weeks, I'm going to get the all clear from my doctor, and then I'll be able to go back to all the things. Mm-hmm. And
as a mom of 4, I can tell you that you don't feel normal at 6 weeks. You are not ready to go.
No, I've been there myself. And so superficial tissue healing has likely happened in that 6-week period. But we fail to consider all of the adaptations, all of the changes biomechanically, physiologically, mentally, all the changes that have happened during the pregnancy. Then there's been a birth, and that could have been a vaginal birth. It could have been a cesarean birth. And with cesarean births, there is maybe a little bit more of appreciation of a need to rest and take it slow because there has been a surgery involved.
Right.
But that doesn't mean that a vaginal birth has left you with no issues. And while the word injury is a strong word, but I do think we have to look at this and say birth really does leave you in an injured state afterwards. And we need to have time for the superficial tissue healing, but also for the overall healing. And I always say the retraining of the core. With all the changes that have happened, there's been additional weight on the pelvic floor. We've had some hormonal influence. We've had some changes to the abdominal wall with regards to the length tension relationship in the
absolutely the increase in the lumbar curve because we've shifted our center of gravity forward. Oh my gosh. Yeah, absolutely.
So many things. And there was very little shared with regards to that these changes be aware of these changes, and here's how you can mitigate them. And here's ways to exercise. Here's what you can be doing from a recovery. Like I look at birth like a marathon or a triathlon or it's a very physical event. And a lot of people refer to birth. They say, oh, birth is like running a marathon. And I'm like, well, it's kind of like running maybe 4 or 5 marathons, really, when you think about it. Mm-hmm. And I would train for a marathon. I would train for a triathlon. So why am I not training for birth? And when I train for a triathlon or a marathon, I have a very intentional recovery period that's included as part of my training protocol.
Right.
And birth should be no different. We need to prepare ourselves for the event, but we also need to prepare ourselves for the recovery period and understand that there will be a gradual return back to whatever it was that I was doing or whatever it is that I want to do that goes well beyond 6 weeks. Absolutely. So I think that there's change is happening, and social media has certainly increased awareness in a lot of different areas. I think we have a bit of work to do, but I reflect back on cultures around the world that have practices about mother warming and mother roasting and how important, there's a book, even the first 40 days. So the first 40 days are kind of what sets you up for the next 40 years. And many cultures around the world, that's built into their life, and it's lived and breathed, and children see it. And so it's kind of this birth is part of their culture. And in North America, unfortunately, there's a supermom mentality. And so birth is just something you go through, and we are now exercising at extremes, even though we're pregnant. And then we are trying to not look pregnant as fast as we can, even though we've been showing off our belly and we've been so proud of it for 9 months. All of a sudden, when you give birth, now it's a place of shame. So we have to hide it and we have to not look pregnant as fast as possible, get back to the gym, take our selfies. We don't need help. We're fine. We got it. And that's at the expense of function. And so that's when a lot of things start to show up and creep up for women, and people just don't quite feel normal. And they think that because they don't feel normal at 6 weeks and they've done something wrong. And, it's just this, there's a whole.
Yeah. And they just think it's probably normal. Everybody else probably feels this way, or there's shame around, well, if I don't, then I've done something wrong.
Right.
I completely agree.
Like that's just part of being a woman, or that's just because you've given birth now.
Right. Well, and let's just talk about all the things that postpartum women go through or are doing in that postpartum period with a weak core, right? Lifting the car seat in and out, lifting strollers in and out, carrying baby, usually on the hip, not really utilizing their core, just kind of shifting over, right? And that's why I'm seeing them for the back pain and the pelvic pain, because we haven't done anything to retrain these muscles that have been stretched and for, 10 months.
Yeah, exactly. And even so my philosophy with regards to preparing for that event is, in fitness, we have a principle called specificity. And if you want to run a marathon, you're going to run increasing distances. You're going to taper off the week before. You're going to go perform. Then you're going to have recovery. Let's do the same for birth. Let's train. What are the movements? What are the most optimal birth positions? What are the demands of labor? Let's factor those into our training. And working on relaxation of the pelvic floor. That's something that's also, I think, overlooked.
Yes.
Go and give birth. But then we also have known, what will we be doing in those early weeks postpartum from a core restoration retraining perspective? And then what's my protocol to return back? But the other thing I factor in there is also movements for motherhood, the car seats, the stroller lifting, the rotation movements, the squatting down, picking up things over and over again all day long. So when we're training for birth, but we're also preparing the body for motherhood. So if we can add in, I do have my clients train with car seats and train with strollers and train with laundry baskets and do unbalanced moves and moving not with perfect form sometimes, because life is not perfect form. And certainly we don't have perfect form. We have babies and toddlers and diaper bags on our shoulders and, all that kind of stuff. So I think we kind of need to expand a little bit the variety and the repertoire of movement that we give to people. And I'm one that I do back up the intensity in pregnancy. I don't think we need to be doing box jumps and 1 rep max type things. Like I just don't. I think we're building a human. Let's honor the changes that are happening and support our body through it and try to maintain that core function as in spite of all the changes that are happening.
Right.
And become familiar with movements that are also going to help us restore postpartum.
Love it. So talk to me about as we age and we go through peri and postmenopause, how does that play into your current offerings?
So my business has really evolved, I would say, as I have evolved through the stages. So initially I was working with pregnant women because I had just gone through that. Then I was starting to work at optimizing postpartum recovery because I felt that was a void. And then people were coming to me saying, well, I gave birth 10, 15 years ago. I'm now having these issues. So then it was a whole learning and also, recognizing that I was in that stage now as well too. So it's kind of been evolving as I have through the stages and recognizing that the conversation of pelvic health isn't just when you're pregnant, isn't just if you have an issue. We have a pelvis, we have pelvic floor muscles that are influenced by menstruation, hormone fluctuations. I think 80% of us statistically will become pregnant at some point in our life. So the vast majority, every single one of us who have a uterus and a vagina are going to go through menopause. So, and menopause is having a day right now. Menopause is definitely out there and being talked about, which is fantastic. A lot of it is because there's a lot of suffering associated with it. And a lot of the suffering we can go back down to the pelvic floor. The incontinence, if it has been a mild problem, is getting worse. Prolapse, if it's been a mild problem, is getting worse. Vaginal dryness, over 80% of people will have vaginal dryness, and that doesn't get better with time. Painful sex, increase UTIs. And so these things may not, sometimes it's the first time they're showing up. Sometimes they're now screaming at us louder. We've kind of been okay with ignoring them along the way.
We've ignored the whispers.
Yes, exactly. And now they're definitely yelling at us. Hysterectomy. Hysterectomy is a huge thing, over 600,000 in the States alone, and often for benign conditions like heavy bleeding. And there can be a case, but there's so many people that go and have a hysterectomy without having even been told the other options of what they could be doing to manage that bleeding. And then when they have that hysterectomy, they are now at an increased risk of organ prolapse. And that's also something else that's not communicated. So I feel like, and still feel that there's a lack of information as it pertains, to pregnancy and prenatal preparation, pelvic floor recovery, that type of thing. I also feel like we need to do a better job at preparing people for perimenopause, menopause, whole body. But again, I'm pelvic floor centric,
right?
So that let's see if we could prevent these things. I'm always about prevention. And if we can step in before we have a problem to overcome, it's never too late. We can always overcome things, but why not be proactive and knowing that I'm going to stop producing estrogen. I'm going to start, the production will slow, and that's going to influence my vagina. So how can I support that? What foods could I eat? How could I move? What should I be seeing pelvic floor physio? What should I be thinking about with regards to my muscles? So hormone piece, nutrition piece, movement piece, all of that is really, really important. And then also people who have incontinence, people who've been having whispers along the way have probably been wearing pads for years and years, which also can exacerbate dryness.
Mm-hmm.
You know what I mean? So it's just
infections, right? And then we have less estrogen on board. And so it's all worsened. Yeah, absolutely.
Yes.
Yeah, it's all connected.
Yeah.
So we can't ignore the vagina. We can't ignore the pelvic floor. Yeah.
Exactly.
Well, I am just so honored to know you and that you are a passionate promoter of pelvic health, and you're using fitness and movement to help women prevent and overcome these challenges like incontinence and pelvic organ prolapse and chronic back pain. I mean, this is amazing. It's awesome.
Thank you. Yeah, I love what I do, and I feel really passionate. And I've also experienced a lot of what I help people through. And I think that's something a lot of people come to me and say, I found you, and it makes me feel better knowing that you had this. So I've had a uterine prolapse. I've had a rectocele. I had a few bouts of stress urinary incontinence, and I was able to overcome it. And then so people feel better knowing that I understand how they feel, but also that gives them hope. Because I think sometimes along the way, people can hear dismissive messages and maybe not think that there's any way out from their current situation. So the reality that a lot of people have is quite scary, and they feel very alone. And I just think there's so much suffering associated with the pelvic floor that I really want to play a role in changing.
So as an OB-GYN, I find this really curious, of course, because, I think that education oftentimes can be very one-sided, but as an osteopath with a neuromusculoskeletal fellowship, I definitely have a mind very curious about my training and about what we can do better and about how we can collaborate more and how we can be open to options. So I'm curious, when you said that you had experienced incontinence and prolapse and that you had cured it through pelvic floor physical therapy, through fitness? Okay.
Yes, except the rectocele. So stress urinary incontinence was, I remember I experienced it a couple of times very early on after my second was born.
Mm-hmm.
So at this point, I still didn't know about pelvic floor physical therapy. I just thought, because I had prevented tearing in both of my births, I thought, well, then I won't have incontinence. That was kind of my thinking at the time. I had no training. It was just, that was it. Right. And then I remember being in an exercise class, and this was my second was probably, I don't know, maybe a little over a year. I can't remember the exact age, but I was doing jumping jacks, and I was like, something just happened. And how could that be? And then, so it wasn't long after that I met pelvic floor physical therapists. And I remember Carolyn Van Dyke was one who sat down with me. And at the end, I just thought, oh my gosh, I need to do this. And I was learning the whole kind of philosophy around retraining the core and the importance of pelvic floor exercise, all that kind of stuff. So that it wasn't a huge problem for me. So it didn't really take long for me to overcome that. And then many, many years later, I had a stage 2 uterine prolapse. I had an undiagnosed autoimmune condition. I was dealing with a lot of constipation, which I couldn't explain what was happening. But anyway, it was autoimmune related to my thyroid and struggling with constipation. And that certainly exacerbated a uterine prolapse. And then that was hypopressives, and I was already seeing pelvic floor physical therapy usually once a year. But hypopressives was the biggest part of overcoming that. Hypopressives is a specific exercise technique that the term means low pressure. And it's a series of postures that are considered, they don't really increase intra-abdominal pressure. And then there's a breathing pattern and an apnea. And the apnea is sort of like a stomach vacuum almost that you may have seen in yoga with Uddiyana Bandha, or some of the bodybuilders do stomach vacuums. It looks similar to that. And along the way, I'd also known I had an early stage rectocele back from the very first time I saw a pelvic floor physical therapy or therapist. And that was sort of, I managed it along the way. And then again, dealing with that chronic constipation, it was starting to become a bigger deal.
Sure.
And tried all the things with that. So that was, all the hypopressives. Pessaries aren't really successful with rectoceles, pelvic floor exercise, pelvic floor physio, estrogen, all the things, and nothing was helping. And I was really struggling with poops, and it was just starting to interfere with the quality of my life. And I debated surgery for about 4 years. And then finally I just said, I'm doing it. I had surgery for that. And I was really afraid, wasn't so much afraid of having surgery, but I was afraid of what it was going to do to my business. Because I thought, oh my gosh, I've been preaching how to avoid surgery, and now I'm going to go have surgery. And, but what I recognized in it is surgery is an option. I don't want it to be the first option that's presented, but it is an option. And there's a lot of shame associated with it. And there's a lot of people who would benefit from surgery, but may not feel confident. They don't know the questions to ask. They, know, so I out of that then created another program, because I just said, this is another huge void where people don't have support through this process. And there's it's a very high recurrence rate in pelvic surgeries. And I think part of it is because people don't address constipation, and they don't address the movement and activity piece, like the core restoration piece, just like postpartum, right?
Right. Yeah, absolutely. Especially if you've got something chronic like constipation that's not addressed, of course, you're going to see that recurrence again. So a couple of things that you said. One, you were talking about pessaries not being effective, and my laptop is actually being set up as we record right now on my box of pessaries.
That's awesome.
There are situations where they're adequate. And when I was training, I was like, these pessaries are ridiculous. They're archaic. They're slippery. I am not using these whenever I'm in private practice. And lo and behold, if every time they don't find me, there is a good candidate for a pessary.
Yeah, pessaries can be great for some people, and rectoceles seem to be the one that they're quite tricky. And depending on, if it's especially if it's a low rectocele, which many of them are, then those are the tricky ones. But I think there's tremendous, some people benefit tremendously from pessaries. And there's actually some really cool innovation that's happening in the realm of pessaries, which I'm really excited about. Some 3D printed ones, and another one that's, I just spoke to this company, and it's almost like an inflatable. So, there is an inflatable pessary right now. But this one has a technology piece to it as well. So it's also monitoring. And so you can use it for exercise and the support of the pessary. So it's just in prototype phase right now, but I think there's some really cool innovation that's happening as it pertains to pessaries. We'll see.
That's interesting. I think that's needed because, most of the younger population want nothing to do with pessaries.
Yeah. And, one challenge I find with pessaries, and this is actually, I would say it's a bigger challenge for the older population, is they're hard. Some of them are really hard to get in and out, and they perform all these crazy acrobatics to get, and then you're never really sure if it's in the right place. And so the one that I'm liking right now, it's actually not necessarily for prolapse, but it can help. A couple of my clients have had it help from a bladder prolapse perspective. It's called the Revive, and it's inserted and removed like a tampon. And that is something that I think is...
You can get this on Amazon. I recently saw this. A pelvic floor physical therapist told me about it. And I was like, well, isn't that handy?
Yes, exactly.
Pessary fittings are a lengthy process. It's a trial and error to make sure that we get it just right. Okay, enough about pessary. So, and vaginal estrogen does the body good.
Yes.
Everyone needs some vaginal estrogen, especially as
1,000%. Yeah.
Okay. Well, tell everyone a little bit about your app and how they can find you.
Yeah, thank you. My website is vaginacoach.com. And basically, if you put Vagina Coach into Google, you'll find me on pretty much every social channel. My app I started a challenge a number of years ago called the Buff Muff Challenge. And it's a 28-day whole body approach to pelvic floor fitness. So it's Kegels are a form of pelvic floor exercise. We have lots of evidence to support that Kegels work when they're done correctly and consistently. I think if we can also coordinate them into movement, it also heightens the effectiveness and also the likelihood that they're going to get done. There's not many people that sit down and do a dedicated Kegel practice every day.
Right.
So the Buff Muff Challenge was meant to be a 10-minute whole body approach to pelvic floor fitness to help people overcome incontinence and prolapse symptoms and back pain and what have you. And the name Buff Muff kind of really struck a chord with people and everybody was really loving this. And so when I created an app, I just figured that's got to be the name because everybody loves the name. So it's the Buff Muff app. It's available for Apple and Android. And I wanted it's free to download. There's a bunch of free resources. There's a free exercise challenge for people to do. And from there, if people choose, they want more, they can I have a whole workout section. There's a whole nutrition support section. There's a whole section with other guest experts. Again, I'm all about collaboration and having other people's viewpoints. So I want to introduce people to all the other amazing practitioners that can support them. And that's all housed in the app for people that want to pay. There's a monthly fee if they like for $27. And yeah, so that's my main thing now is I want as many people to be able to have that in the palm of their hand and get the reminder every day to pay attention to their pelvic floor and then have the resources to know how to do that.
Yeah, that's awesome. And so you also will get on a call with others for 30 minutes and kind of go over all of the details and decide what program's right for them. Is that what that call is for?
Yeah, the Discovery call is meant for whatever people want. I mean, some people want to know what program is best. Some people want to know who do I talk to? Some people want to know what exactly is happening. It's taking me forever to get in and this is what I've been told, but I still think this. And I'm obviously not diagnosing, but I can help people, understand, but who they can see to seek help and get the answers they need.
Yeah. Okay. Fantastic. Well, thank you so much for joining us today. This has been a pleasure, very informative and excited just to know that you're out in the realm preaching all about the pelvic floor and pelvic health.
Yeah, I really appreciate it. It was lovely chatting with you. Thank you so much.
All right. Until next week, be well.
All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB-GYN with a neuromusculoskeletal medicine fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.